Hello, you guys, and welcome to our monthly installment in partnership with AdventHealth. We are talking about your health. I'm Jorge Estevez. Thank you guys so much for joining us. For the next half hour, 40 minutes, we're going to have an interactive conversation. You guys are going to drive the conversation, and we're going to help you along the process. And we're going to talk about your health. And today's show is about men's screenings. Now, so many times, adults, we do not take care of ourselves. Maybe our partner encourages us to take care of ourselves, and we don't. So we want to inform you specifically about the things you need to get going, depending on your age. And we're going to focus on your prostate health. This is a big deal. You know, you're supposed to get these screenings. We're going to tell you when. We're going to show you a surgery. I'm going to go into the OR, kind of, sort of, and we're going to show you the technology that's being used right here in Central Florida at AdventHealth. Wait, this way. At AdventHealth to make sure that these surgeries go smoothly. And we're going to talk to kind of like the biggest deal in prostate health. He is here along with a patient, along with a pelvic rehab specialist, all these things to get you going. We're going to address some uncomfortable things that you may not want to address at home, but we want you to share this on your Facebook page because we're going to talk about prostate health and what that does to urination, what that does to your sex drive, how that changes your life, and how it doesn't have to change your life if you catch it early enough. So again, I'm Jorge Estevez. I'm not doing this alone. We have a panel of people, experts, so let's open up the camera. Here they are. A big round of applause from the 5 people in our studio. There we go. Fantastic. Thank you guys so much. By the way, this is an iPad that I have here that I am looking at the newscast. I'm looking at the show right here. And I want you guys to, I encourage you to tell me from where you're watching from. We're going to chime. We're going to take your questions, all that stuff. So to my right, thank you so much, sir. Dr. Vipul Patel. He is a prostate cancer physician. Thank you so much for showing up.
Thank you.
He brought one of his patients, Paul Kennedy, who's here. Paul, thank you so much. And we have Shantae Perry, a physical therapist.
Hi.
Hi, thank you guys so much. This is exciting. This is your first times here.
Yes.
That's correct.
Yes.
During this whole thing. All right, so what we're going to do is we're going to take your questions and show you guys a couple of things. So this is really important, and we're so glad we're doing this. We're talking about prostate health. So share this on your pages for the man in your life or the men in your life, brothers, sons, husbands, all that stuff. Because why is taking care of your prostate so important, Dr. Patel?
Well, the prostate definitely is a big deal. All men have one. Obviously, women do.
Paul
not.
doesn't.
Well, unless I've gotten to them first.
Exactly. And prostate, it's a big deal. What does the prostate do? Go ahead. Let everyone chime in on that while I take a look at some of the comments that are coming in.
The prostate, really the main function is earlier on in age. It's for reproduction. It provides some of the fluid that helps the sperm travel. Once you're past the reproductive age, theoretically in men, it's a vestigial organ. It doesn't have a function.
All right, so we have a couple people chiming in. China Hernandez saying, hey, y'all. She's saying hello, chiming in. Jason, where is Mel Gibson? I'm unclear as to why that is in here. Judy, thank you so much for watching. Jason, thank you for chiming in as well. We got some fast facts for you, too, at WFTV.com and on this page. All right, so we don't need the prostate after we're done having kids. True or false?
That's correct.
That is correct. But the prostate helps us do a couple of things. What does it help us do, and why do we need to make sure it's healthy or take it out?
Well, reproduction. It serves a vital function in reproduction. As far as we know, that's the main function. The problem is, throughout, as you age, the prostate can cause problems. It can grow. It can cause blockage. That makes men go to the bathroom often. It can get inflamed. It can have prostatitis. And obviously, you can get cancer of this organ as well.
Now, according to the stats that we were working with AdventHealth to do this, 163,000 men are diagnosed with prostate cancer every year. Is that a lot in the medical world of cancers and diagnoses?
It is, actually. It's the most common solid organ tumor in men.
Okay.
It's the #1 cancer in men.
That is the #1 cancer in men.
Yes.
What would it be in women? Do you know? Is it breast cancer?
It's going to be breast cancer.
Could be breast cancer. All right, so you guys, have you ever had issues with your prostate? Did you start getting checked for your prostate? What was your first checkup like? I mean, let me know. Seriously, this is what we're doing. We're talking about this stuff here. So there are 29,000 deaths from prostate cancer every year. Can that be preventable? How do we do that?
It's been a challenge. For the last 40 years, we've been doing a better job. The death rate has gone down. The problem is it's still the second leading cause of cancer death in men. Only lung cancer in men is more likely to cause mortality as prostate.
Really?
Yeah. So even though we've had significant advances in 40 years and the death rate has gone down, prostate cancer is still the second leading cause of death.
That is incredible. And Paul, we're going to get to your story in a second, and then Shante, we're going to talk to you. But just hearing those numbers, you guys, isn't that incredible? So what we wanted to do, we went to AdventHealth. We'll show this to you in a second or two. We went to AdventHealth because Dr. Patel, seriously, is no joke, a huge deal. And the fact that he's here in our backyard at AdventHealth is incredible. People from all over the world come to have him operate on their prostate. And let's go ahead and open it up because I want to ask you, why is that? Why, seriously, go ahead, tout yourself. And we can ask Paul this question too. Why is it that you've kind of become this big deal in prostate surgery?
Well,
and your team and all that, you know, it's not just about you, but...
Yeah, it's definitely not because of Disney.
Right, no.
Yeah, we've done the most of these operations in the world.
Aren't you up to like 13,000 at this point?
We're getting pretty close. And a lot of what we do is about practicing expertise, and after you've done a certain amount, the operation obviously becomes easier. Ultimately, it's about outcomes. We've demonstrated the best outcomes in the world for many, many years now.
And people are asking about sex. Of course you are, you people out there. One person, Morgan, asked, will sex be enjoyable for my other half if he doesn't have it? And let's go ahead and ask, let's talk about sex. Let's talk about sex. Is sex enjoyable, Paul?
Sure, absolutely. I mean, one of the outcomes is what is the alternative in all of this? Because you're eradicating cancer.
And let's go ahead and just seriously talk about that. You had an issue. What was your issue, Paul?
I was diagnosed about 2 years ago with a primary care physician with a PSA screening. My PSA blood test was high. It had jumped. And through my primary care physician at AdventHealth, Mattel, Rakesh Patel, no relation, my urologist, I was recommended to see him. And on the wisdom of the preeminent prostate cancer surgeon in the world is this gentleman here, and we're blessed by that he is in Orlando. We elected to have surgery, and he removed and found the cancer that was in me, removed it, and with rehabilitation and post-operative care, you return in a reasonable amount of time within a year to full functionality.
So I'm going to ask you a couple of rapid-fire questions. Do you urinate fine?
Yes, you urinate better after the surgery.
Something to
than
look
you
forward
did
to,
before.
everyone. Something to
Am I
look
right?
forward to.
True? Sometimes. But I'm saying that yes, and the other obvious question is, can you control it? That is where she comes in, because you regain control. You regain control of your urology, right? And then in terms of sex and whatever, doctor could speak to this.
He can speak about your sex life?
No, but in terms of nerve sparing, with the surgeries that are performing, and you're going to show them today.
And we're going to get into that, the nerve sparing thing, and that's going to be key. But what you talked about rehabilitation, let's bring in Shante here really quickly. So tell me, rehab, are people scared when they say rehab for my prostate surgery? What does it mean? Give me like a big umbrella.
Yeah, definitely. So as a pelvic health physical therapist, we're really targeting a very specific set of muscles called your pelvic floor muscles. And these muscles really give the structure and support to the urethra after prostate surgery to prevent that incontinence from occurring. So if we can strengthen those muscles, increase their endurance, and really get these guys to activate them, then they're much better equipped to go through their day and their life and their routines with little to no leaking after the surgery.
China had a question. It is Dr. Vipul Patel who is speaking here. There were some questions about who you were and your first name. I guess they missed it. All right, so the rehab is almost as important. And Dr. Patel, you were talking about the fact that the rehab is key in getting those functions back, right? Getting the urination normal, getting the sex drive normal, but it's all about the nerves. What is the secret to preserving the nerves around the prostate, and what is that? Explain to people what that is.
Well, the prostate's a complicated organ. It's deep down in the pelvis, it's hard to get to, and it's basically almost in like a hammock of tissue.
Okay.
And this tissue has nerves, it has vessels. The prostate sits on the rectum between the bladder and the urethra. And so imagine you're going into a very small space and you're trying to do basically a neurosurgical operation. You have to cure the cancer, you have to save the nerves, save the continence, save the sexual function. And this is what makes the surgery difficult, and I think this is one of the reasons people travel from all over the world to see us, is for the nerve preservation and cancer cure.
All right, so it's very important that we're talking about this because people don't know what age they should get screened, what kind of screenings. We're going to tackle that now. Then we're going to continue to look at your comments. Then we're going to show you a robotic surgery. I went into the surgery room. All that's coming up in the next few minutes. But first, we have John. I need my glasses. John Rumpf. John Rumpf. Dr. Pete just did mine May 7th. Do you remember a John Rumpf?
Absolutely.
Recovery has been good, just like he said. See him Wednesday for 7-week follow-up. Sorry I missed the single port Da Vinci.
Okay.
Was he buying you a bottle of wine?
No, there's,
I hear single port. I don't know. Is that
there's a new robot.
Oh, the new robot. Oh, okay.
The one Paul had you make 6 holes. With the new one, you can make 1.
So do you remember a John Rumpf? And regardless, 7 weeks, he's supposed to come and do the
We
follow-up.
took care of him and his brother.
Wow, because you said the whole hereditary thing is a problem.
Yeah, prostate cancer is quite genetic and hereditary. If your father's had prostate cancer, if your brother's had prostate cancer, the rates go up exponentially. African Americans and people with a family history.
We were talking about that. The African American community, greater risk. The second there's in the family, it expands their chances of getting it.
Yeah, we tend to screen African American males and men with family histories earlier than the regular population.
Some people joining us in. Alice joining us in from Miami. Yelena says, my dad had some issues with his prostate. Can the surgery be avoided? Is it possible to avoid prostate issues? What are the causes? That's a kind of a loaded question, but can the surgery be avoided once you detect stuff, no?
Absolutely can be avoided. It's kind of a third. A third of the patients that get diagnosed go on active surveillance. Not every prostate cancer needs to be treated, which is nice. And sometimes you can wait. A third of the patients go to surgery, and they're usually ones who are younger, more higher risk, patients who really do have a long life expectancy.
And these are some fascinating numbers for you guys. Age 50 for men who are at average risk of prostate cancer and have a life expectancy of at least 10 more years. Age 45 for men at high risk of developing prostate cancer, including African Americans and men who have a first-degree relative diagnosed with prostate cancer at age younger than 65. What is, Dr. Patel, a first-degree relative?
It's like your brother,
Okay.
basically.
Now, Paul, did anyone in your family, was
No.
prostate cancer a thing?
No, my brother, my younger brother, he's 60 now, I'm 65. My younger brother has been diagnosed. His PSA number is right around 6 right now, but he's in a monitoring program.
PSA is what?
Post-biopsy.
And what's PSA?
That is your protein-specific.
Prostate-specific antigen. PSA is the screening test for prostate cancer. That's the one they're talking about in terms of screening.
Simple blood test.
Every
Simple
man
blood test.
Approximately age 50 yearly should get a PSA and a digital exam of the prostate. That's basic prostate cancer screening for general population.
Digital exam of the prostate. In English, that means what?
A rectal exam.
So rubber glove, finger up the anus.
That's the plan.
That's what it is. And now you're supposed to get these starting at what, 40, 45?
Yeah, definitely 50.
Okay.
Some patients, African American males, family history, people with prostate issues, they'll get examined earlier. But otherwise, age 50 is quite reasonable.
And when you have the digital exam, you can feel the enlarged prostate, you can feel bumps. What are you looking for?
Yeah, you're
Because
feeling...
they take so long. They're like, hold it, wait, relax. And it's like, it feels like it's a minute and a half, but obviously...
Well, you've maybe seen the wrong person.
Yeah, maybe. That's probably what it is.
It should be a quick in and out. You're done.
Oh, wait a minute. Maybe I should make a phone call. We're laughing because we're supposed to make light of these things. But it's true, though. What are you feeling for?
Yeah, you're feeling the consistency of the prostate, the size. You're looking for a nodule. The challenge is most of the cancers diagnosed these days are not found on exam only. They're found by PSA, the blood test.
Paul, yours was found with the digital and then some, or what?
No, it was found, and Dr. Manicherry did this, the primary care physician with Advent. My PSA number in an annual physical, and doctor, it's important to ask your primary care physician, make sure on my blood test, is that PSA test in there. He detected, he said, your number has jumped. I think it went from 3 to 6.
Okay.
3 to 6, and he said that is cause for concern. Reference to a urologist, and that was Rakesh Patel, who performed a biopsy on my prostate and detected the cancer there.
Wow.
And was sent to Dr. Patel here. But blessed by the fact that you have all of these surgeons working in concert with this wonderful place, but their wisdom and experience, and then with his recommendation was to go on ahead and have it removed.
No, it's incredible. We can talk a little bit more about surgery, then get into the rehabilitation with Shantae over there. And I'm going to show you now in the next 30 seconds my experience with the robot. Let's talk about the robot really quickly. The robot, the Da Vinci, is a fascinating way to get inside because the prostate's the size of what, like a golf ball?
Well, it's about the size of a walnut, But it depends. You can have a normal size. You can have, the day you came, we had someone who had basically 10 prostates in one.
Yeah, a very enlarged prostate. Not cancerous, just
Correct.
prostatitis, you call it?
That one, he had severe urinary problems that he couldn't urinate at all because the prostate was this big.
All right, so the functions of the robotic surgery, which you can find at AdventHealth, smaller incisions equals less pain, faster recovery. You may be able to spend a little less time with Shantae over there in rehab. Much less blood loss equals less risk for blood transfusion and much less of an invasive situation. So let's go ahead now. What I did was I went down to which place was it? Celebration. I went down to AdventHealth in Celebration, and we watched. It's a two-parter. You're going to see the first part, then we'll come back and talk to us. The first part is me experiencing the Da Vinci, which is the robotic situation, and we operated on that old school game when we were kids, Operation. So, Ty, if we can roll that so we can give people an idea at home of the robotic surgery that really, how it maneuvers and how it works to help the surgery go more smoothly at AdventHealth. Hey, Roger, how are you doing?
Good to meet you, George.
You're the robot guy.
I am the robot guy.
You don't look like a robot guy.
I know, mostly flesh and blood.
So what are we going to do here today?
So we're going to look at how the Da Vinci robot works. We're going to teach you what Dr. Patel does every day of work.
On a human being?
He's going to work on a human being. You're going to work on the Mattel operation game.
Fantastic. Let's do this.
All right.
Come on. All right, so what do we have here? That's the operation game.
That's the operation game. You're familiar with that. You were a kid. You
Most
played.
of my childhood.
Yeah.
Yeah, I always buzzed.
We all did. So I'll tell you the secret. You know what you do? Take the battery out.
Nice.
Take the battery out.
Well done. So
you
what's
see
going to
all the
happen?
little pieces in there, and it's really challenging when you're doing it yourself with your own hands, right? So we're going to do this with the Da Vinci robot, $1.8 million worth of robot to help you do this.
That's what this costs?
Yeah.
Wow.
$8 million.
Okay.
And we're going to get magnification from the camera, so everything's going to look big. And your instruments are going to be smaller than your fingernail, so you'll be able to get into those tight crevices much easier.
All right, let's do it.
No buzzing. So this is the surgeon's console. This is where the surgeon does his work all day. You get 3D stereo vision.
Right in here.
Right in here. Yeah, you'll see it like you're watching Avengers, only it's going to look better than the Avengers.
And it's free instead of the cost of the movie.
It's true. It's free. It's free. Your hands go down here on these controls. I'm going to put my fingers in here. See how they close with a thumb and an index finger, thumb and a middle finger, whichever you like best. One in each control. So I actually have to belly up to the robot to get it to work, because it has a sensor that knows if my head is looking in here or not. If I'm not looking, it won't operate. Makes sense, right? Okay, I'm looking. Now I take my controls and I clip them together, and once I clip them together, it knows I'm holding on, and I can move these instruments.
It's moving.
Right.
But you're over here.
I'm over here, so everything that I do here gets transferred over there to the robot. So I can reach in with these instruments that are pointy and grab that little gummy frog and pull him out, and I'm not even close to touching the metal sides that would cause this to buzz.
So now it's my turn. Okay, I've got foot pedals, hand things. There's a lot going on here.
So look in there
Hello.
and see what your world looks like.
Wow, there's two little silver little hand things, and there's the big operation patient guy.
Correct. Now take your hand and put it on these controls.
Whoa!
Yeah, are they moving?
Yeah!
Good.
Whoa!
Yeah. You got
So
it?
what this does is this gives you a really precise view of what you're doing.
That's right.
It's like having super sight goggles.
Yeah.
All right, so with this machine, Roger, the goal is precision, right?
Precision, yes. Safer surgery, more control for you, less human variation, less human movement and stumbling, and more precision.
And less room for error.
Less room for error. That's right.
Okay, so I did it okay the first time, got the gummy bear, but guess what? There weren't batteries in it. Now they're putting batteries in it. Now is a real test. Oops. This is crazy. Here we go. Boom.
Clean.
Look at that. I did it. Thanks to the help of that robot right there. And I was buzz free. How about that? that?
It's free. That was great. We didn't actually put the batteries back in.
What do you mean? So we don't know if I did well.
Well, we think you did.
All right, I'll take it. It's still a pretty impressive view. I mean, come on. They did not tell me they forgot they did not put the batteries back in. But either way, I think I did pretty okay. That was incredible. That machine is incredible. So many people have chimed in, by the way, since that. Sean, thank you for getting my glasses. Thank you, Dr. Patel and Shantae, says Gary. Matt Heron says Dr. Vipul Patel, the top robotic surgeon worldwide. Did you pay him to comment like that? Oh. Teresa says fascinating. Dr. Roger Smith, pioneers in robotics, FRS, DOD, telesurgery, etc. So people are chiming in. And Teresa saying, thank you for focusing on men's health. That robot thing was incredible. You guys have no idea how sensitive that was. What was it like the first time you operated using that machine years ago? When was it, by the way?
It was back in 2002, so it's been a while. It, like everything, like driving, it has a learning curve.
The major differences pre-robotic surgery and post-robotic surgery on the body, the recovery, we touched on them a little bit. Smaller incisions, faster recovery, much less blood, et cetera, et cetera.
So when I trained, I actually trained the old way, with open surgery. And it was a pretty generous size incision on the abdomen. Key was you couldn't see very well. You know, deep down in the pelvis under the pubic bone, it's very hard to see, a lot of blood. And so the outcomes were not what we wanted. And so the robot was a fantastic evolution.
Not a lot of blood because it would flood, because the incision was so big, if the blood would flood in there?
No, the main blood supply to the prostate is in an area that's very difficult to see from the outside. And so often you couldn't see what was bleeding, and it was very hard to suture. So it kept bleeding until the operation somehow was over.
That is fascinating. There's so many of you watching right now. I encourage you to go ahead and share this on your pages. Share it when it's done. Share it now. It's going to live on our WFTV Facebook page forever. And you can go ahead and share it. AdventHealth is going to share it too, because these are important things to talk about. Why don't men, Paul, your buddies, and I'll ask Shantae the same question, why don't they want to talk about it, feel weird talking about it? Is it because it's about urinating? Is it because it affects your sex
We're
drive?
all private, but yes, I think the fear of being emasculated,
right,
which heretofore doctor would know better than I and what you were just talking to. But that has gone away in large measure. Doctor, I say that presumptively, but it has. And that is what I try and communicate to others and my friends, that with the robotic surgery and Dr. Patel's team, that you have a very high probability of having the cancer eradicated, your nerves being spared, your sex life being restored, and being healthy once again.
And Shantae, talking about the people in rehab, what do they talk about? What are they fearful of? What are you seeing emotionally from your patients?
Sure, yeah, we're dealing with a lot of sensitive topics, and sometimes there is that reservation to not open up, maybe because of stigma that occurs in society, but really creating that comfortable environment to just say, hey, what's going on with your symptoms? That way we can better treat you and direct your plan of care is so important to these patients. And I think as more of this word gets out, the better off we're gonna be long-term, and just being open, because so many people are going through the same journey.
Do like guys pull you aside, or your staff, and say, hey, is this thing gonna work in 4 weeks or 6 weeks, or am I gonna be able to perform? Am I gonna be able to, I mean, it's a question that people ask, right? I mean, isn't that what they ask you before the surgery?
Absolutely, all the time.
And then, so what do you tell them? What's the answer?
There's not one answer for everyone. It's different. It depends on your age.
Right.
It depends upon how your sexual function is going in, the amount of cancer. Not every nerve can be spared, obviously, because if the cancer comes out of the prostate, where does it go first? It goes to those nerves.
Right. So you may have to get rid of nerves because they're infected, because they're damaged.
Well, they have cancer inside them.
Right.
And so you have to take them out. And so it's a balance. You have to balance the cancer and the outcomes of your rest of your life.
But in the end, I mean, we have our facts. We have a team of people back there working, and we just posted this on the same feed. The American Cancer Society says there will be nearly 175,000 new cases of prostate cancer in 2019. There will be around 32,000 deaths. We have more facts on WFTV.com. When hearing that, Paul, isn't that like you could have been a statistic?
I certainly could have. And I was very fortunate because when the doctor removed it here, he said it was within the margins, but it was starting to spread. Doctor, does it spread, and where does it go when it metastasizes? I mean, there are organs surrounding this, your bladder and other areas.
Yeah, the key to finding prostate cancer is find it early. If you can find it early, it's highly treatable, or you can observe it. If you find it late after it's broken the capsule, It can get into the veins, it can get in the vessels, into the lymph system, and it can go to the lymphatics and metastasize, and that's why it's the second leading cause of death in men.
And we're going to talk about some of the things that Shantae can teach you to do to kind of get that pelvic strength back.
Absolutely.
Is that's what you would call it?
Yeah, absolutely. Working on pelvic floor isolation, awareness, strength, and endurance are very important to these patients. And if they're not used to contracting these muscles voluntarily, then there is a little bit of a learning curve as well. So.
All right, so we're going to talk about that. We have another story I want to share with you guys that I'm going to share with you in about a minute, which is the actual surgery. You're going to see Dr. Patel go into and start operating on a prostate. This is not a prostate that has cancer. This is just an enlarged prostate, right?
Huge.
Huge prostate. I believe he said it was one of the largest he'd ever seen in his, how many years?
Yeah, since 2002.
Since 2002. So we're going to look at that in a second. But I want to ask you three, talking about fears, what was your number one fear, Paul, going into this? Besides dying, I mean, there's that.
Oh, absolutely. Number one, that the cancer had spread,
Right.
and you don't know, and what your Gleason score would be and how you're going to come out of this, the level of cancer that you had, that was good. And number two, would you still retain your functions, right? And that includes urology, being able to get that back under control, which takes a little bit of time, but it does come back thanks to Chantal and all this. It does come back, you can. And then your sexual function, do you get that back? That can be treated both with medicine and then the nerve sparing. But so those three, cancer, your lifespan, and your quality of life all come back. And and what is amazing here, people come from how far around the world? How many countries are coming to see you, Doc?
And we've had probably 45 countries visit Orlando for surgery these days.
Coming to see him, and he's right here in Orlando.
Yeah, and we do stories all the time on Eyewitness News about medical tourism. There's another word for it. What's it called?
Destination Health.
Destination Health, which is a lot fancier than medical tourism. But Destination Health is a real thing, and AdventHealth has him and a bunch of other people too, but that's incredible. So now what we're going to do is we're going to show you when I went in to hang out with Dr. Patel, and we actually went and I got to see him do a surgery on someone who signed the proper paperwork. But we're going to go ahead and see a very large prostate, and we're going to walk you through the process. We're using that robot that you saw me work on. Now, I didn't touch the patient, but he's going to go ahead and he's going to use the robot, and you're going to see. So take a look. All right, so here we are getting the ins and outs of this amazing surgery. Dr. Patel, thank you so much.
Okay, great. Thanks for coming.
This machine does everything. I kind of played with it earlier. And what does this allow you to do?
Well, it allows us to do a minimally invasive approach for many different types of surgeries. I specifically take care of prostate cancer. So it allows us basically to enter the abdomen with cameras and do the surgery through small instruments instead of making a big incision and putting our hands in there.
Before something like this, a surgery would take how long?
Well, it depends who's doing it, obviously, but many hours. It used to take probably 3 hours to do a prostatectomy, and
now?
And now, probably an hour.
And it's less invasive. How is it better for the patient?
Well, it's better for the patient and I think for the surgeon. Here we can actually sit and do surgery in a relaxed atmosphere. There's less pain for the patient because we have less holes. There's less bleeding, so less risk of transfusion. So in general, they go home faster.
So this is easier for the kind of the pace of it all, or how does that affect anything?
I think surgery can be stressful, and if you can sit and do it in a relaxed atmosphere, I think you have a better outcome.
You feel like this machine allows you to do a better job?
For sure. I think 95% probably of prostatectomies for cancer in the United States are now done robotically using this.
All right, so you're going to be on that machine doing the actual work?
Yes.
And I'm going to be here not doing anything, just looking.
Correct.
Fantastic.
Correct. You can see so the advantage of having this machine is the surgeon now has 4 hands. So we have these instruments that deliver energy. Basically, it's cautery, and so you have to, obviously, when you see blood vessels, you have to cauterize them so they don't bleed.
My God.
We've done about 12,500 of these, so we have the most experience of any place in the world here in Orlando. And so we have people come with interesting challenges from all over the world here to get their surgeries done.
That is fascinating. What was the end of that surgery? Did everything come out okay? Did you take out the very large prostate?
Yeah, it was successful.
And recovery took a little longer because it was so large, or how was that?
No, actually, it was more difficult for me because it was so large, but for him, it was the same.
Normal, how long does it take?
Normally, it's about an hour or so.
And this one, because the guy had 10 walnuts instead of one?
Maybe an hour and 15, not too much longer.
Recovery, a week?
Yeah, he was home the next day.
Well, how can a partner help someone? Like, how could, I know your fiance is sitting right over there, how could she help in the process? Is there certain things that one can do?
Yes, prostate cancer, I refer to it as a couple's disease. Or a family disease. Everyone's affected, not just the male. And so the best part is when the couple comes together for their preoperative and postoperative evaluation. I think that emotional support, that understanding, the questions. The wife sometimes asks the best questions.
Right.
It's important. The support is very, very important.
You look like how was your fiance? Did she do a good job?
Absolutely. I mean, the sincerity of concern and the nurturing that he mentions, that you have people because you're vulnerable when you're coming out of this, and the certainties do not begin to build out of this till you begin to see the results, which are going to be days, weeks down the road.
So we're going to wrap up here in a little bit, but so here's what's going to happen in the next 4 to 5 minutes. We're going to ask the benefits of robotic surgery. We're going to read some comments, and then Ty, our director, does not know this, and I apologize ahead of time, but Shantae is going to walk over here in a little bit and hang out in this space, and she's going to teach me how to do some of those exercises to enforce my pelvis. So she's going to kind of hang out here, so if you can make that a little wider shot, and we can do that in a little bit. Because I think that's important, and this is a live situation, and we were talking about during that story, so we're like, let's show everyone. All right, so Enrique saying this is an amazing situation. How can a person support their partner, said Katie. We asked that already. John, your patient, checked in on Tuesday, surgery, checked out the next morning. Entire team was a pleasure. Julie asking this question, you guys. If you have had prostate cancer and 3.5 years later, the PSA is now 1, how does that work?
Yes, once the prostate's out, the PSA should be undetectable. Should be
Okay.
less than 0.1.
Or 0.1. Maybe she said 0.1.
0.1 is correct.
Yeah.
Yeah, it should be 0.1 or less, and that's considered normal. Any changes from that, you have to go back and see your doctor.
Julie, thank you for doing this work. Betty says the robotic surgery is awesome. Simply amazing technology, says Enrique. How do people feel right after surgery? That was one of the questions that someone asked. How did you feel right after surgery? We have somebody right here.
I felt pretty good. We did have some obviously pain medication there, but you came off that rather quickly. I was thinking about this today, doctor. There was very minimal pain attached to this post-operative. Can I add one thing too? My number went up, doctor, to post-operative in a year went to 0.15, and I underwent radiation at that time. It's your recommendation, Dr. Biagioli. Matt Biagioli did it at AdventHealth, had 40 sessions.
You had 40 sessions of
40
radiation?
sessions, and now it's undetectable. So it took away what
Is
would those
40,
be?
does 40 seem to a lot, or am I
The
just...
protocol that it was.
40 sessions of radiation?
And what happened? The cells go, they're free body cells or free floating cells that would need to be.
In your case, the cancer had broken through the shell, and that's the key, is the best time to diagnose prostate cancer is early, with screening before it breaks the shell. Once it breaks out, the chance of it moving somewhere,
Of course.
recurring, is much higher.
Karen saying African-American males and all men who have family history of prostate cancer need to be vigilant, which is what we said at the top of this when we joined you. All right, so if we have that camera ready, Ty, I'm going to ask Shantae to come over here. Come on over. Just walk right over. And I'm going to take my... Oh, that's your microphone. That'll be $75.
Oh my goodness.
That's fine. Here, I'll get it.
You got it.
There we go. That's fine.
Okay.
We have more of these in the back. It's totally fine. All right, so turn around. I'm going to put this mic on you.
Sorry.
Okay. This is live TV, people. This is what's happening. I'm miking her up. This is the beauty of doing this. Okay, here we go. All right,
Okay,
so
George, so typically
I think
when
we can get a little tighter, Ty. Okay, go ahead.
Closer. Typically, when we initially assess the pelvic floor, it can be done internally or externally. So
Okay.
we're going to do it externally.
Yeah, we
today.
are.
Okay.
We're not doing internally nothing. No one, I didn't sign a consent form.
But we also utilize biofeedback, which is really nice for the patient because they're connected to external sensors that are placed on them, and they're able to visually see in real time how their muscle is functioning.
All right, so what is this?
This is essentially your pelvic floor muscles, which are a series of muscles that lie deep inside your pelvis.
Okay.
And they provide structure and support to the urethra and help prevent leaking from occurring. So to hypertrophy them, to strengthen them, to make sure they're working accordingly is very important.
So is this the anus?
This is that external anal sphincter, and
Okay.
it's going to come and wrap all the way around to the pubic bone in the front. and
Okay.
apply some pressure to that tissue of the urethra.
And without a prostate, your job is to make this wall
As strong,
function.
yes, as stable as possible. We want the patient to be able to recruit these appropriately during activities that might cause leaking. And we want these muscles to specifically become stronger, increase their endurance, increase their isolation and awareness of these very important muscles.
Let me see if people are chiming in here as I hold this pelvis. Please share. Thank you very much. God bless all doctors. It's awesome to show a patient that has actually gone through this. They're saying you're awesome, Paul. All right. So how early should one be screened? Do we have a number? 50? You said
For the general population,
50.
age 50.
All right. So here we go. So now you're going to teach me what is it. Show me what we're going to do on this. What is it like? It contracts. It
Sure.
expands.
Yeah, exactly. So a contraction is really closing.
Hold it up there.
So a contraction is going to be pulling these muscles together, and it almost has a little lift to it. So I'm actually going to have you sit.
Oh, I'm going to sit down.
Yes,
Okay,
yes,
I'm going
yes.
to sit down. Should I? Okay. I'm going to sit down.
You're going to sit. Okay.
here we
and
go.
then I'm going to ask that you not contract any of your lower abdomen.
Okay, so I think we should probably be pulling out here a little
Okay.
bit. Okay.
Your inner thigh stays completely still, and there's no movement in your glutes or your buttocks. I'm going to ask you to keep breathing naturally, and I want you to think about pulling the penis in, stopping the urine, holding back the gas.
Careful what you ask for, people. All right, so wait, stop. Okay,
So
I'm
take
serious.
a second. So no abdominal recruitment.
So
there you go. So
don't-
relax your
don't-
abdomen.
Don't suck it in. Got
Do
it.
not squeeze your glutes or your inner thigh, and then
Okay.
go ahead and think about stopping the urine on the toilet or getting into a cold body of water and having that testicular
That's never
lift.
good.
Now,
Okay.
we're going to ask that you hold it for 10 seconds,
Okay.
maintain your breathing,
Uh-huh.
and don't recruit anything else. So keep your abdomen very still. So did you see how you wanted to automatically
That's because I don't
activate
want you to
that?
feel my belly, Shante. Right now, my belly is
Oh,
all
my
out.
belly.
Okay.
So learning how to correctly recruit these muscles, holding them for 10 seconds,
So it's like holding my pee.
essentially, but you're not going to be doing that on the toilet. When you're urinating, we want the urine to come through, and we don't want any resistance.
So you're in essence, you're contracting like the tip of your, and you're like that. That's what it is.
Yes, sometimes you can see the male parts actually move a little bit as well. But again, a lot of times patients who are not used to using these muscles are using their abdomen, their inner thigh, and their glutes to assist with that contraction.
And you don't want to use
And
any of
that's
that.
Correct.
Because you want to build that muscle.
If you can't isolate it, you can't get it stronger. And so figuring out where the patient is starting
That's
is really
fascinating.
important. So if they're holding for 3 seconds, we're not going to go home and ask them to hold for 10.
Laura says, George, pay attention.
Okay.
Get serious, says Paulette. Is that pelvis to scale? I'm going to go with no, right? No.
No. On the smaller side.
All right, so that's it. So that's one. Is that the only? There's other exercises, I'm sure.
Well,
but.
it's really important too to make sure that the patient's relaxing in between, because if you have a lot of tightness in between, then
Right.
you're performing these contractions inefficiently. And then eventually we want to build a global base of stability throughout the pelvis. So activating and strengthening the muscles that work synergistically with the pelvic floor is important eventually. But learning to isolate those muscles correctly
That is fascinating.
is very important, and coordinating them with things like coughing and sneezing or bending and lifting is also very important, and is difficult for someone who has a hard time even finding them.
Is that when you sneeze, you pee a little?
Absolutely, yeah.
Right, and you normally hear that in women who've had like some babies or whatever. You kind of get that
Which is
too.
another reason why sometimes when our males come to see us, they're a little confused because they perceive pelvic health as being women's health. But in all actuality, we all have pelvic floor muscles that can be improved upon.
Fantastic. Well, thank you so much. Big round of applause for our demonstration here. Thank you guys so much. That was fascinating. Thank you, Ty. I sprung that on our director last minute. But it was fascinating. And when you see that, did you have to deal? We're almost done
Absolutely,
here.
and you're still doing those exercises.
Really?
You know, and you do it with more regularity at times than others, but it works. It does.
Yeah.
Did you find your situation bettering as the weeks
Absolutely.
of surgery,
It
of
works.
rehab?
You know, you might somewhat be doubtful that it would, but it does.
Julie says, with a Gleason score of 7 and positive margin ×1, robotic surgery January 2016, now the PSA is 0.1. That's what Julie's saying.
PSA 0.1 is good.
Right.
Yep.
That's fantastic. All right, this is a test. There's a test after, says Laura. Pelvic floor rehabilitation is a critical step in the recovery process to maintain a good quality of life. And Marina saying thank you. So what are some of the takeaways here as we wrap up this special presentation of men's screening in conjunction with AdventHealth? Dr. Patel here, Paul Kennedy, and Shante Perry, correct?
Yes.
Perry, physical therapist. What is your one takeaway if you had to tell your patients?
Just be comfortable opening up to your PCP, your urologist, your physical therapist. Ask for the help. There's so many people out there going through these similar issues. So a lot of times there are treatments that maybe you don't even know about. So, try to break that barrier or the stigmas that we maybe hold. That way you can really maintain and receive the best line of treatment and care.
We'll leave you for last, Paul. Dr. Patel, what do you think? What's your takeaway for people? Is it screening when you're 50? Is it getting the regular blood work and getting your PSA looked at? What is it?
Yeah, I think really the key to prostate cancer is finding it early. And screening is very important. Prostate cancer is the second leading cause of death in men from cancer. So it's highly relevant, but found early. It can be treated or watched very carefully.
At AdventHealth, at Celebration, where you work, how many patients do you see a week?
Oh, sometimes 90 to 100.
And that's a lot.
That's a lot.
What is the average, and why do you see so many? Because you're that good, you're quick,
No, we're one of the referral centers from around the world, so people come from all over, and we try to help them. So we try not to limit. We can only see so many, and that 90 to 100 is a lot, but we really do try and help these patients. They come from everywhere, from all walks of life, and you have to help them. That's why we're there.
So, Paul, what's your biggest takeaway here? Being a young man, as yourself, surviving this disease, living to tell about it, and to say, you're what, 95%, 90%? You're good?
I'm great. And I think we're in the company of angels in Orlando, in the fact that with AdventHealth, we have the finest physicians, the finest surgeons in the world that are advocating for you to get a PSA check. You can be cured and live a healthy life with Advent and in this Orlando community, unlike generations before anywhere on earth didn't have. We're really blessed here with Dr. Patel, with Chantel. It is an amazing
As far as you as a patient, what's your takeaway?
Getting screened early, knowing that number. And I say to my friends, George, I would say to you, what's your PSA number, George, from your last physical? You would say, I don't know, it was low, right? No,
My digital exam lasted too long, I know that. But that much I can tell you.
But you need to know that number, and you track that, and if it moves, then that is the red light that warning you that there may be a situation.
Fantastic. Well, this has been fantastic. We've had the attention of so many people who have been asking questions, so we want to thank you guys too. This is an interactive conversation. You guys help drive the conversation. And, again, we were not making fun. We were simply making light and kind of just talking about something that to some people may be uncomfortable. So I think it's very important. I want to thank you guys so much. Big round of applause for our panel here. Thank you. Our poor floor director is like, I can't clap anymore. Thank you guys so much. Really important, really key.
George.
And thank you. You deal with people at not their most vulnerable, but when they have a lot of questions and they feel like, am I going to get better? And you and your team gets them better.
Yeah, and we just love being an extension of that support system that they're already receiving from Dr. Patel's office and just helping them along the journey however we can.
All right, fantastic, and thank you for the example of my test. That went very well. Thank you guys so much again. Do me a favor, go ahead and share this on your Facebook page because men's screening and keeping you healthy is key. So I want to thank AdventHealth, Dr. Patel. I want to thank Paul. I want to thank Shantae for coming in today, and thank you guys for really just giving us your attention and some of your time. Please share this on your page. Please share this on Advent. Go to AdventHealth if you have any questions. Make sure you see your PCP. Wherever they may be, and ask if you're a guy or your wife listening to this or your partner, ask, what is my PSA? What should I be doing? So thank you guys so much. I'm Jorge Estevez. We do this every month, and we have a new topic next month. We'll let you know. So thank you so much. And please continue asking any questions right below here, because we're going to have Dr. Patel, although he doesn't know it, log on tonight when he gets home and answer any questions from people there. That's part of the gimmick. We didn't tell you. So you have to go and answer the questions. So ask your questions. Dr. Patel's going to answer them. He's kind of a big deal, so he's not going to steer you wrong. All right. Thank you guys so much. Please share this on our page, and we'll see you for the news every night, Monday through Friday at 10 o'clock on TV 27. Good night.